Hi, I'm Megan Kingsley Gale with the Hospital Practice Handbook Project for acupuncturists and their hospital sponsors. And we've had a really busy last few weeks. I know everyone has had, actually, last few months, everyone has had a very unusual last few months as we've been, as a country in the United States and in the world, been dealing with the global pandemic, the COVID-19 pandemic. And for my community, the hospital practice acupuncturist community, we in the United States, we've been particularly in need of having discussions about our pandemic prep and response as being hospital practice providers. So we were having a lot of discussion in our social media groups and a little bit by email. And it was to the point where we just really need to get together and have Zoom discussions. So this is my first public-facing review of what we've been doing in our discussions. So those of you who haven't been participating but were kind of interested in it as hospital-based practitioners or who are acupuncturists, or those of you who are program managers of hospital-based acupuncturists, just wanted to give you an idea of what we've been doing and the hard work we have been doing. And what I've been learning, I have learned this before, but these themes have been popping up in the last few months, is that perfect is the enemy of good enough. So it's just good to just go ahead and share the information that we do have and the resources we do have, even though it's not perfect and it's not finished and we don't have all the answers. But we have been talking about things and vetting ideas, and we have learned things. So we do have stuff that people can learn from, and we have developed SOPs, and we are learning from each other. This is a wisdom sharing community. And there are standards and guidelines that have been developed. So just wanted to share with you a little bit about where these resources are and how you can access them. And again, this is primarily for hospital-based practitioners who are acupuncturists and their program managers. And to be clear, so there's a little bit of the goal of the discussions. The idea was to share wisdom, ideas, innovations, and standards about each other's programs, COVID-19 pandemic prep and response. So we started the Zoom discussion sessions outside of just the social media closed discussion sessions on March 19th. And we've had 2 to 3 sessions a week, Zoom sessions a week in the early days. And now in May, I'm trying to keep it down to just once a week and then catch up on the content and getting the content uploaded in a way for us to share with each other easier in the in-between time. So it's been a lot. So the themes have been like perfect is the enemy of good enough. And as a founder and facilitator of the Hospital Handbook Project, I'm always balancing between creating content and talking with people versus telling people about what we're doing. So each of those activities takes about the same amount of energy, and I always have to try to balance those two things. So today I'm telling you about what we have been doing, and so please forgive me that I haven't been telling you guys exactly what we've been doing, because at first we just wanted to just have time to talk to each other. We didn't really have a lot to share. We just had questions. So just to outline for today, thank you to our supporters, a little bit about where to find content from these sessions, an introduction and review of the community discussion to date, some volunteer opportunities that are available, and a review of 2 of our most asked about discussions in the community right now, the Telehealth Resources and the Moving Past the Surge, What Does Reopening Look Like resources. So a big thank you. This discussion is available because of support from the following. Any of our March, April, May community discussion supporters who supported at the $25 level or above. Sandra Grassa of Evidence-Based Acupuncture, who has supported an entire session and helped a lot with other sessions. So thank you very, very much, Sandra Grassa. And for a current list of those who've supported at $25 level or above, go to that link there. You type in that URL, and you can also learn how you can support as well. big thank you to everyone who subscribes to the membership site or has bought me virtual coffee in the past year. That goes a long way. Thank you. And of course, my husband. The Hospital Practice Handbook Project would not exist without him and all of his support. So thank you to my husband. So a little bit about how you can help. This is how you can support the community discussions. A current outgoing cost estimate for each of those discussions is about $200 a session. And that's looking at like if we could, in an ideal world with that kind of support, we could do the estimate about 200 to 250. We could do transcripts and as well as video editing. So most sessions, as you guys saw on the past page, I don't have that support for. So I'm doing my best. I am 100% volunteer with all this work, and but you can definitely support and help with the outgoing costs through these links. So there's support the community discussion specific link. Anytime you can always buy me, you do the virtual coffee option. There's that link. And if you don't know about it already, we do have the Issues in Hospital-Based Practice webinar series we've been trying to get going for the last few years, and the plan was in 2020 to get that up and going. And these community discussions on pandemic prep and response are very much a part of Issues in Hospital-Based Practice. So those resources are in that that online resource, Issues in Hospital-Based Practice, on the Teachable platform in our online school. So you go to that link, and you can do a month. You can sponsor it all at once for the year, or a monthly sponsorship, whatever works best for you. And you have access to our current videos and resources that we have going on. Some incentives based on some past interviews. You have access to those, and then any future sessions that we do in 2020, you will have access to those as well. So it's kind of a neat way. Supporting the Issues in Hospital-Based Practice webinar series is a neat way to get access to stuff right now, and as well as be able to support us being able to do more sessions in the future. So if you choose that option, that would be wonderful. But again, you have all these different options to choose from, and they all help make these community discussions possible. So just a review of the Hospital Handbook Project resources to date. We do have quite a few resources already available. And so we have these public resources that are available to everyone, and they are. So if you guys have trouble finding these, just message me on our website. Go to the website and then the contact us, and I'll have that URL on one of the future slides here coming up. But these are just kind of give you an idea of what we do have already available as resources at the Hospital Handbook Project. And we do have some resources that are still in beta testing. I'll always have some resources in beta testing. That's just how things go. So just review of what review of what we did in 2019. So in 2019, so the Hospital Handbook Project's been going on for a good 5 years now. And I had been posting to the website and the blog content based on topic. And what I was kind of looking at in 2019 is who was using the content and how to reorganize the content based on who was using it. So I have started that process, and I've noticed that we have 4 basic types of people who are using the project. We have the students, prospective practitioners, the new hospital employees, and from getting hired into up about to year 5 or so. We have our lead acupuncturist, program managers, and we have our hospital admin. So we do have closed discussion group resources that are available. We have the membership site. All you need to use the membership site is email. And then all the resources are co-located. They're easy to find. And then our social discussion resources are the closed Facebook discussion group and the closed LinkedIn discussion group. So again, this is where to find our COVID-19 discussion resources. So this is where to find them to date. So you can go to the COVID-19 discussion standalone module, and here's the URL for that. Again, it's constantly being updated, and after 9 weeks, we do have quite a bit of content in there already. And then this discussion standalone module, I have bundled into the membership site for those of you who are on the membership site. And the standalone module is bundled into the Issues in Hospital-Based Practice webinar series, which I mentioned earlier. So when you follow this URL, on the Teachable platform to our online school, you'll see this beautiful photo of a bridge crossing a river. And that is the Issues in Hospital-Based Practice webinar series logo. So if you sign up for that, you will also have access to the COVID-19 community discussion standalone module. And this is what the landing page for the community discussion module looks like. I did start at the end of March per community request. We started a separate group from our normal closed Facebook discussion page just to look at COVID-19 research references and resources vetting, because there was just so much information to go through. It was a lot to be posting in the main group. So we moved it to a separate group and have volunteers in there. Just looking at research and references and vetting them, from case studies to a series of case studies to any RCTs that might be available, or new research that is just being started, new clinical research. So if you are, if you have a little bit of clinical background or just basic understanding of research and acupuncture, you are an acupuncturist, we are looking for volunteers to vet resources and other projects. And if you have questions about that, if you're not sure if you should participate, please just send me a message via the contact page on the website. Our next Thursday community discussion for May is May 28th. We just had one this week. So our next one is going to be in 2 weeks. And then we're also looking at, the group has been requesting a telehealth roundtable panel. So I don't have a specific date for that as of today, but we're looking at June possibly to do the telehealth roundtable panel. So if you have questions for this panel, please send your questions for them with use the topic tag telehealth panel question to the contact page on my website. If you're watching this video and you're like, hey, I really would like to be a sponsor for that telehealth roundtable session, you also contact me via the website. If you feel like you should be a speaker for that session, definitely, I'd love to hear your ideas and your background, and contact me via that same URL. Thank you. So just a review of some of the themes in healthcare in the US the last few months. We've got to isolate potential cases to decrease spread of contagion, testing supplies, lab capability, PPE supplies, sending all non-essential personnel home to work remotely until supplies arrive, move paid remote workers who are clinicians to do admin catch-up, complete chart notes. That was at the very beginning. And then things have kind of, have been very variable and subject to change. So after that initial sending home some of the outpatient clinic workers, the people were looking at, well, can we reach out to our patients and do telehealth, virtual telehealth, phone consults? If you didn't already have that set up, what do you need to set that up? What are the new guidelines? And we'll talk a little bit more about that in a few more slides. You're helping other providers on your team from taking on tasks, from helping the nursing staff and other options like the hospice setting we heard about, making sure patients have food. That's part of their healthcare that they can deal with in the hospice setting. A lot of practitioners were working on projects from updating standard operating procedures, refining particular programs, creating new programs, creating resources for in-house professionals, creating resources for patients, such as patient educational material, creating resources for patient care. And some of the group came back and said, well, I finally have time to do my data analysis for my research that I never had time for before. So just a variety of things. Here's just a quick list of the ongoing discussions that we have in the Hospital Handbook Project community. Some of them, these are discussions that we're constantly having, and some of these we've had gotten to a point where we've been able to do some presentations on them, such as the telehealth programs. So again, those that we've had presentations on, I have a few dates for that. Most of the others we've talked about a few different times, just not necessarily specific presentations on them unless there's a date. We have had a few presentations on what does the reopening path look like just within the last few weeks. So here's just an overview of some of the telehealth resources and where to find them. So in that online COVID-19 discussions, resources for community discussion module, we have a section on telehealth. And within this section, each of these lectures has PDFs, and some have PDFs plus video. It has multiple resources. And some of these are getting constantly updated, or getting updated every other day at the beginning there. And hopefully now just getting updated weekly or less. And then as we give presentations from the community on that, we do put the presentations up when they are approved. So just some quick slides on telehealth and acupuncture. It's when you're looking at remote work, or even tiered reopening, or even just being able to reach patients who otherwise can't come in, telehealth is a great option, not just for primary care, but for specialty care. And that includes us as acupuncturists. Whether you're an acupuncturist working in primary care in a hospital-based setting, or in a specialty clinic. And that reminds me, I meant to explain what I mean by a hospital-based practice. Hospital-based practice, I define as working as an acupuncturist. You are working in a facility that is accredited by, or eligible for accreditation by, the Joint Commission. If you're dealing with the Joint Commission quality assurance standards, we all have that in common. So when I say hospital-based practice, I'm certainly not referring to only inpatient work. I'm referring to inpatient work, outpatient work, working at any of those organizations that have to deal with the quality assurance standards by the Joint Commission, whether you're accredited by the Joint Commission or looking to be accredited by the Joint Commission, those organizations. Because when working on those standards of quality assurance, everything that we put together has the same basic standards and quality assurance measures. So we have all that. We have that as a basic way to move forward and share ideas. So that's going to include our federally qualified health centers and our hospice. So telehealth resource document, we have a telehealth resource document there. There's the issues of patient, when you are doing telehealth with a patient, if the telehealth is in that patient's home, which our new telehealth policies thankfully allow you to call a patient or do a virtual call with a patient in their home. They don't have to be in a clinic for the telehealth for Medicare to reimburse the telehealth. Sometimes patients aren't in the same state where you have your license. So especially if you live near a state border. So we've talked about that. Consent forms need proper equipment, evaluation management, telehealth codes, and then recommendations from Marilyn Allen and many more, looking at modifiers, knowing your service code location. The Department of Health and Human Services Emergency Response and Telehealth publication dated March 30th allowed for these platforms. Please check with your facility organization about what they want you to use. And these are all these resources are in that telehealth section on our online module that I showed you where that was. So this is just kind of a sampling of what is on there. And more, this is part of the resources that are on there. I have gotten a couple questions about, when you switch to being remote and reaching people by telehealth, what are some ways to look at doing that? And if you have a program where you've been teaching self-care to patients, it's going to be a little bit easier to transition to that model, because you can still, when you're doing virtual care, you can still be teaching self-care and coding for self-care and that sort of thing. Now, how coding and reimbursement works is very complicated, and that's where we're going to have a telehealth roundtable to kind of talk about how people are looking at that and dealing with some of those issues. So, because I don't have the answers, and so it's best to kind of talk with your colleagues about what's working, what's not, and some of the issues behind all those things, which sometimes they can get complex, especially when it comes to reimbursement. So here is our how to send in your questions to the panel. Again, that we're hoping to do that in June. And yeah. So the other topic that has been really popular is, what does returning to direct patient care look like? what do tier reopening plans look like? And we have talked about this, and we have some presentations in the online module about this. I recommend looking at the presentation from Thursday, April 30th. Topics that we talked about, we're looking at questions around all these different topics. It can be pretty complex. And I did do, after we had that discussion, I went back to my slides and I did a Facebook Live review of just the slides to the Facebook group. So for those of you who are in the closed Facebook discussion group, it is right there. And then in a short time, as soon as I can get through up the whole time that it takes to upload and download things, it will also be available in the online resource with the date April 30th. So when you're in the Facebook closed discussion group and you're looking for topics, to go to the right-hand side here under topics. This was added, I think, fall of 2019. Facebook added being able to tag things with topics. So you can see we have more than 50 posts just on COVID, 50. And I'm always kind of helping sort through that and moving stuff to help make things more clear. And then we have a specific set started on COVID tiered reopening plans for discussion on that. So this is kind of some examples of some of the things that have started, discussion sessions and resources that we're sharing in the closed discussion group. And this is also available in the online resource. So this is where you can find this in the online resource at this URL. And then you look at go to the section moving past the surge, standards, guidelines, and more for reopening. And the first set that I uploaded were the national guidelines for resources for when you're writing standard operating procedures. Here are the Joint Commission reference, the OSHA reference, NIOSH, CDC, CCAOM, and the CMS. I've been hearing that the CMS guidelines have been really helpful in writing, looking at tiered care and writing SOPs. All right, so you can support these community discussions through these different options, and these are the URLs. I hope you consider doing that, and if you're a hospital-based practitioner, you are welcome to join in. Just send me a message by that Facebook, go to our website and go to the contact page and send me a message that where you work and that you're interested in joining in. All right, thank you very much. I hope you guys keep working through all the big changes, and peace to you as you navigate all the changes. And I hope the Hospital Handbook Project can be a good resource for you so that you don't have to reinvent the wheel, that you can work with others, share wisdom, and learn from others' mistakes. Thank you.